What happens inside the human body when a rattlesnake bites someone on the leg? The venom does not remain only at the bite site. It can spread, damage tissues, and disrupt several organs. During the bite, the fangs usually inject venom into the tissues beneath the skin. More rarely, if a blood vessel is hit directly, systemic effects can appear much faster. In the first minutes, the venom acts mainly locally. It attacks cells, weakens small blood vessels, and triggers an inflammatory reaction. Pain, redness, and swelling begin quickly. The venom increases the permeability of tissues and capillaries. Fluid leaks from the blood vessels into the surrounding tissues, causing the leg to swell. The edema can progress within hours and may involve the entire limb. At the level of the skin and soft tissues, the venom can cause bruising, blistering, and sometimes tissue destruction known as necrosis. The larger the amount of venom injected, the more severe the local damage can become. Some rattlesnake toxins also destroy muscle fibers. This muscle injury may remain local, but in severe cases, it can release toxic breakdown products into the bloodstream. Once it has spread through the tissues, the venom eventually reaches the circulation. From that moment on, it no longer affects only the bitten leg, it can disrupt the entire body. Rattlesnake venom often interferes with blood clotting. It can lower platelet counts, reduce fibrinogen levels, and disrupt normal clot formation. As a result, the risk of bleeding increases. At the same time, the venom damages the walls of tiny blood vessels. Fluid, proteins, and sometimes blood leak out of the circulation. This worsens local swelling and can reduce the effective blood volume. When a large amount of fluid leaves the blood vessels, blood pressure can drop. The heart must work harder to compensate. If the envenomation is severe, this can progress to shock. The victim may develop shortness of breath. In some bites, especially with more neurotoxic rattlesnake species, the respiratory muscles may weaken, making breathing dangerously difficult. The kidneys are especially vulnerable. They can be damaged by low blood pressure, blood abnormalities, or by toxic products released from injured muscles. This can lead to acute kidney failure. The nervous system can also be affected. Depending on the species, the person may experience weakness, tingling, muscle twitching, confusion, and in some cases more severe neurological impairment. Systemic effects are common: nausea, vomiting, diarrhea, sweating, anxiety, and a general feeling of illness. In some cases, the person may even notice a metallic taste in the mouth. The whole body is beginning to react to the venom. In summary, everything begins with local signs in the first minutes: pain and swelling. Within hours, swelling and tissue injury spread. Then, if the venom enters the circulation, effects on the blood, kidneys, breathing, and circulation may appear. A rattlesnake bite on the leg is therefore not just a local wound. It is an envenomation that can evolve into a systemic illness affecting tissues, blood, kidneys, breathing, and circulation. In a real bite, emergency help must be called immediately. Keep the limb still, stay calm, and go to the hospital urgently. Do not cut the wound, do not try to suck out the venom, and do not apply a tight tourniquet.